Hi, my name is Steve Dalbey, and I've been working at CrossRoads here for 4.5 years. And I just want to tell you a little bit about what I'm passionate about in the areas that I specialize in and have a passion to work in. For a lot of my story, I've done work with the middle school and high school populations in doing youth ministry full-time in a church setting up until about a year and a half ago when I started doing counseling full-time here at CrossRoads. One of the things that I have spent a lot of time learning about, studying, and working with is that area of diagnosing and working with attention deficit disorder, helping families and students and children understand what it is, helping them understand what their options are as far as being able to deal with it and help optimize their giftedness as well as minimize some of their weaknesses, and also helping behaviorally with that in making friends and keeping friends, and working on building skills to help people suffering from that know how to have better impulse control. So some of the other areas that I do work with is depression and anxiety, which, believe it or not, often come along with attention deficit disorder. It could be one of those three, it could be all three of them, or a combination. And so that's an area that often sometimes indicates those other things might be there. It can masquerade as the other. Not always, but that's something that I've learned over time. And also just, it's in my own story even, I have been diagnosed with attention deficit disorder, and so part of my own journey in learning about how I'm wired is what has led to me wanting to specialize in this area. I think that's given me a helpful insight into working with others who are also struggling with something similar. As we all know, it can be very challenging if your attention is not very focused in our current culture. There's a lot of distractions, and on some level we all have things that give us attention deficit just because of the situations we're all facing with all the different distractors and stressors. But when it becomes clinical is the line that delineates between whether or not it needs help or medication, or whether it's just sort of normal cultural distraction. I know a lot of people think that ADD is both overdiagnosed or something that isn't real. But a lot of the work that I've done and a lot of the things that I've read and studied show great evidence in the brain, with SPECT scanning and being able to see what parts of the brain are over and understimulated. And so it's been really neat to see people benefit from having a name for what it is they've struggled with, being able to have treatment, including medication sometimes, that works wonders in their marriages, in their jobs, in their schoolwork, and their ability to just stay on task and prioritize and focus. And so it's been really neat to see people's lives begin to change from learning about how they're wired and what they have available to them. Another part of my story is that I was in the United States Marine Corps. Right after high school I enlisted, and I have a real heart in working with our veterans, in doing work with post-traumatic stress disorder, and some of the real complications that come from being married in the military and having your husband or wife out on deployment, raising children often as a single parent in some ways, and just the moving around environment that comes with the military lifestyle. If it matters to you as well, I'm also a pastor's son, so I've got a little bit of experience of what it's like to grow up in the church and to see the underbelly of the church, and also the wonderful blessings of the church as well. So that's a little bit about me and what I'm passionate about. I enjoy working with the age range of 10 to 30, but also older than that is perfectly fine. And I do marriage counseling and premarital counseling as well, and I've really come to love that over the past year and a half. Thank you very much.